February 4th marked World Cancer Day, with the government unveiling ambitious plans to ease access and treatment of the third cause of deaths in the country, cancer. However, Kenyans from all walks of life are searching for ways to survive as treatment from cancer remains elusive.
That's right. So in tonight's special series, The Long Wait, The Painful Wait, Mercy Kandia takes you through the remedies and state of cancer treatment in the country. From village surgeries to the very long queues for radiation in the hospitals. Here's Mercy Kandia's piece.
Making his way into Kapiego, the heart of rural Marakwet, 35-year-old Nixon Kemboi wears a grim, determined look on his face, foreshadowing what lies ahead. He traveled a long way for this, over 100 kilometers from Marakwet to West Pokot. Ahead of his arrival, the setup for what will be his workstation is being finished up. It's his operating theater. And Nixon, or Daktari Nixon, as the people here call him, is a traditional surgeon. Once at his open-air theater, Nixon goes through his pre-surgery drill. He needs to. Soon, someone else's life will be in his hands. Today's patient, Chebo Cheptoch Loitabella, has painful recurring growths on her leg and arm. Dr. Nixon says it's cancer, so he has to perform a surgery that involves removing what he says is a tumor in her arm and leg. With what few items Nixon received from local hospitals, he prepares Chebo Cheptoch, and the surgery begins. Amid her deep pain is a desperate hope. Chebo Cheptoch knows this is the only option of getting better. Her youngest son, Paul, restrains her. He has taken her to various hospitals but has not found treatment for his mother's ailments. All hope has been placed in Nixon and in his traditional medicine now.
Tukakuja kufanyia operation, alafu tuweke dawa ya kienyeji ya nyumbani. Sasa niko na mwaka mingi nimeanza hii kazi tangu 96 mpaka saa hizi bado niko nafanya hii kazi.
Villagers gather to witness the surgery. Many here have been operated on before. Hospitals are miles away, but that is not the only issue. Transportation to the facilities and the money to get there is not available, only helping to strengthen their faith in traditional medicine.
Yenye inasema damu ni kuna dawa yenye napea ili ile damu isiende sana, yenye nakunywa, na kuna yenye inawekwa kinonda itoe chafu yote alafu mkuu ikae mzuri.
Mwangalia akisema anaweza. So ni hali ninaiamini yeye kama amesema.
But village medicine isn't the preserve of these villagers alone. Caroline Kemunto from Migori County was diagnosed with breast cancer.
Nilikuja hapa nilikuwa nakohoa vibaya, hata dawa hospitali nimekunywa mara mingi, lakini hiyo kikozi gogali niambia ni hiyo kansa ndio nini, lakini sasa vile alinipea dawa ikamaliza kabisa. Nilikuwa na insurance but insurance pesa ilisha na nikaanza kutumia pesa yangu kwa mfuko. Nikafika mwisho, sasa nikawachana nayo.
Today she is here to get more medicine from Gogo Irene. Gogo Irene Toroitich has been a herbalist for 20 years, learning the tools of trade from her father-in-law who died last year. Gogo Irene says she knows how to detect and treat cancer.
Najua kama we nasema mguu hapa nauma, napima hiyo. Kama kwa tumbo napima, kwa mkono nasikia msiba si mzuri, hata ingine nakunjana namna hii nasikia kwa mkono tu. Kugua iliendelea mwaka 10 kuchua, si haraka. Si haraka. Naenda pima tu mpaka nasikia msiba namna gani, hata kitu nakunjana namna hii nasikia. Hata kwa roho napiga namna hii nasikia, naenda maambika kwa roho. Sasa roho napiga namna hii, kile naenda chini sipike na nyamaza tu pole. Kile nachacha na maliza tamara.
They say it's God's gift, and with or without money they treat.
Kama mtu hakuna pesa, namwambia tu pea hiyo iko kwa mabuko. Naenda kutenda kutafuta na lete mbulubule. Si kuchache haraka. Kama kwa mingi ni 3,000.
In just a span of 5 hours that was spent here, Gogo Irene saw 4 cancer patients. She says the numbers are increasing. Kemei Stanley was Gogo's patient for 2 years. He brings others who are suffering to receive what he got from here, treatment.
Hadi sasa niko sawa. Mimi ndio sasa wakati nianza kugonjeka nilikuwa na 70 kilos. Na wakati niligonjeka sana nikabaki na 49 kilos. Na right now tunaongea na wewe niko na 87 kilos. Hata mama yangu mzazi hajaamini vile sasa naendelea kukua. Sasa ile kitu tu ilikuwa ni doctor, hata yule mwenye angenifanyia operation alikuwa ananiambia niende wanirudie hiyo endoscopy wa confirm kama hiyo kitu kweli iliisha ama haijaisha. Lakini kulingana na mimi, kwa sababu nilikuwa nikishika hivi nasikilia hata kwa nyama juu, kwa sababu hapa ilikuwa ngumu kama mbao. Sasa sikuwa naifinya niingie ndani, lakini nikisikia saa hii nasikia iko sawa kabisa.
Part of the reason why many seek alternative cancer treatment in the villages is this: the long lines at the oncology department at the Kenyatta National Hospital, with only 3 types of treatment available in Kenya.
The first one is called chemotherapy, which means giving medicines which can be given through the mouth or through the veins. And then the second one is operation or surgery. And then the third one is called radiotherapy.
The Kenyatta National Hospital is the main referral hospital in the country and the only one offering radiotherapy, but the hospital has only 2 radiotherapy machines.
At the moment we have over 1,000 patients waiting. Our booking is now till the 2016. If you come in today, you can only get your radiotherapy 2016. We are actually one of the few countries in the world that operate from 6 a.m. in the morning up to sometimes 10 p.m. or midnight to try and cover the large number of patients who flock in for radiotherapy. In a day we treat, just on 2 machines, we treat between 100 to 160 patients.
Treatment of cancer still remains expensive. It costs a minimum of 500,000 shillings, too much for the multitudes who need it.
It's an extra burden for me because I cannot be able to commute from Kirinyaga to each and every day. So I was forced to be admitted here. And lately now we have a very great challenge about the NHIF. They have said that they are not paying our bills from first. So it's like I want to go home tomorrow. I'm not yet treated fully, but I cannot be able to stay here because I cannot be able to pay the bills now by myself. So it's a challenge to each and every one of us.
Parents whose children have cancer have to stay with them in hospital, an even bigger burden when one can't work but has to provide and care for the family. Childhood cancer accounts for 15% of cancer admissions at KNH.
Kenya, where we have about 1 million children being born every year, the new cases of childhood cancer are usually almost the same, irrespective of where you are in this world. So usually out of every 1 million children, you will get about 100 to 150 developing cancer every year. So which means in Kenya we should probably be having 1,500 children with cancer every year. As you can see from the numbers, if you're seeing 100 patients here and others are being seen in Kenyatta, we are probably seeing less than a third of all the children with cancer in this year. Means the rest are dying before they even get to the hospital.
Cancer is the third highest cause of death in Kenya, with estimates of 39,000 new cases annually and more than 27,000 deaths per year. Everyone is reaching out for what works and what is accessible, even if it isn't in Kenya.
So the ones who don't want to wait that long usually have an option of going to Uganda, and they go to Mulago Hospital, where they are able to access radiotherapy a little bit faster than in Nairobi.
At the Moi Teaching and Referral Hospital in Eldoret, a cancer and chronic diseases center is being constructed. The expectation is that it will be ready this year, easing the suffering of patients and delivering a promise to decentralize cancer treatment. This week, President Uhuru Kenyatta launched what he calls the most ambitious drive to resolve health challenges in the country. A 38 billion shilling project that would see every county get a cancer diagnosis center, among other interventions, by May this year. But politics already threatens to stand in the way of this. And diseases like cancer don't wait for politics to be resolved.
All counties will have at least one level 4 and one level 5 hospital equipped with theatre, laboratory, renal, intensive care and radiology equipment.
Out of the 38 billion, 21 billion is actually cancer treatment machines. You know, radiology, you know, X-ray machines, you know, mammography, whatever, to make sure that these county hospitals can be equipped and people do not have to travel to Kenyatta National Hospital.
If the plan is realized, Cheptoch in West Pokot County wouldn't have to go through this. The queues at KNH would be shorter. No one would have to wait for a year to get access to radiotherapy. In the meantime, the old and the young in the city reach out to that which is accessible, and in the villages, their hope lies in this doctors and herbal medicine. 2 worlds, 2 practices, but they both have to wait, the painful wait for better services, affordable medication, clearly showing how fast and swift action is needed to ensure every Kenyan claims their right to access proper health care. Globally, efforts are being made to curb this killer disease, cancer. Here in the country, Kenyans whose loved ones have been affected are desperately seeking for ways to ensure that their loved ones feel much better. This be it modern medicine or traditional medicine. Marcy Kandie for KTN.
Right, and what an interesting piece there. And as Mercy spoke to the Cabinet Secretary for Health, saying 21 billion of that 38 will be geared towards cancer treatment interventions in the counties. An absolutely sad state that people have to go through.
Extremely sobering to think of the things that people are going through in this country. Open air surgery, you know, in a day and age where you have the kind of machinery to be able to mitigate the kind of problems that we have with cancer. It's good that the government is stepping in, but the burden in terms of cancer patients in this country is just tremendous. And you know,
Right.
our support to all of those people who are going through the kind of pain that, you know, cancer takes you through.
So let's see what happens by May. As I've said, the rollout of that very ambitious program in the health sector, and your feedback on that also is coming in, so keep that coming through. 22155 is our SMS number. If you want to contribute to Mercy Kandia's story tonight, the hashtag is the painful wait, but we want